They've assured me and others that this happened, there was an outbreak, but it's been contained and it won't happen again.
We don't want to forget that many people have been affected health-wise and have died throughout the region. And many of those clusters of deaths have happened in long-term care facilities or nursing homes. So I just wonder, generally speaking, what are some of the concerns and some of the safety measures that are being put in place in long-term care facilities throughout the region?
Basically, no more visitors are allowed in. The workers that do work at these facilities, when they come, they're getting their temperature tested. They have to have their masks. They have to have their face shields. So a lot of rules are being put in place, but we're still having these outbreaks. Interestingly enough, MultiCare, which runs and owns a couple facilities in Spokane, they have what they call a drop team. And so if they hear that there might be a case at a nursing home or a long-term care facility, they'll go in, with permission, of course, of the owner of the facility, and look at how hygienic it is and what rules they have in place, and they'll issue some recommendations. And so that's pretty interesting because they have, an infectious disease expert with them. They have the MultiCare is one of the head doctors going there with them. So they've gone around, and I think I believe last I heard they had inspected or had issued recommendations to 250 long-term care facilities in Eastern Washington, which is almost all of them. So they've gone around and done their due diligence and tried to prevent outbreaks from occurring where they haven't yet.
And one area of precise concern that you've covered is the Spokane Veterans Home, which is run by the state VA, not the federal VA, two distinctions there. But tell us some of the dynamics that have happened there in the Spokane Veterans Home and why people are so concerned about that.
Well, yeah, and that's how I found out about the MultiCare drop team, because they went into the Spokane Veterans Home. And so just to go back in time a little bit, in late March, one of the people that works at the Spokane Veterans Home had some symptoms. They got tested. They still hadn't got their test results back. During that half shift, from what I've heard in my reporting, they had contact with two of the residents there. Now, over the next month, those two residents died, and 36 or 34 other residents tested positive for coronavirus. Now, you look at the other three veterans home in Washington State, there's only been one other positive test case, and that's in Orting. And then there's been a positive employee test in Walla Walla. So clearly there's something going on at the Spokane Veterans Home. There was an outbreak. I haven't really got a clear answer. I don't think anybody knows yet. I don't know if anybody will ever know what happened. Everybody's kind of pointing to that one employee who came in and put the seed down. Of course, nobody's blaming this employee. It was early days. We still were all confused of what we should do. And if anybody really should shoulder the blame, it's the facility. But again, I've talked to the people at the Spokane VA Hospital, and as you said, that's federally run as opposed to state run like the homes. And they say, the home did everything right. They did everything they should. Once the MultiCare team came in and issued the recommendations, they accepted them all, and they've made it a very clean running place. And so they've assured me and others that this happened, there was an outbreak, but it's been contained and it won't happen again.
And as we talk, at least, a number of those people who were diagnosed at the Veterans Home have been transferred to the VA hospital, the federal VA hospital in Spokane. Any kind of update on numbers there, or what their condition is, or how they might end up coming back to the Veterans Home?
Yes, of course. It's about 30 residents of the Veterans Home have been moved to the VA hospital. And none of them are in intensive care. They're all being isolated, being monitored. I asked how long they might be there. Of course, nobody knows. The rubric they're using is they have to have 2 negative tests within 24 hours apart from each other. So that's the rubric right now, but we really don't know. I mean, the VA hospital has undergone a massive transformation. I was up there a few days ago, and you see all these tubes coming out of some of the rooms to create negative pressure. I talked to the medical director today. They just have a whole army of nurses and nursing assistants there on hand to make sure everything's going well. The COVID unit has 3 different levels to it, as far as, you've got the room where the patients are, you've got the staffing room, then you have a whole separate room where the stuff is, where there's another employee who, as they said, wipes down the staff when they come and go, just to make sure they're not carrying anything with them when they leave or when they come in.
You can see more of Nick's reporting on these and other topics at nwpb.org. Thank you for joining us, and stay safe, stay healthy, stay home out there in the unique Northwest.